My name is Jocelyn Metzger. I'm the owner of Sunshine Therapeutics in Waynesville, Ohio, and an expert myofascial release therapist with a specialty in the stretches, because there's so much you can do for your body at home that I want to teach you that. So you don't always have to go back to a therapist or a chiropractor or a doctor when something hurts. You've got a good amount of tools you can use at home. In our upcoming class, we're going to be focusing on stretches to balance the pelvis. So I'm going to show you a couple key areas to release before doing any of the other pelvic balancing stretches we'll learn in the class. One of them is the psoas, which you can access from your belly button, a little out and a little down. The psoas connects along the lumbar spine here and then cuts through and inserts on your hip. So in order to stretch that, there's multiple ways. I'm going to show you one that will lengthen the psoas that you can use laying on your bed. And I'm showing you this in my bedroom because that's where I do my stretches, where you'll probably do your stretches, as opposed to me showing you on a therapy table. So I lay down on my bed at an angle so that I don't feel like I'm falling off, and I let my leg closest to the edge hang off. And then I just rest back. You're welcome to put a pillow under your head if you need that for support. And maybe grab one of these soft releaser balls and put that right on the inside of your pelvis, just with the weight of your hand. If you feel the stretch without putting the ball there, don't worry about it. And you just lay here with your knee bent on the opposite side so that it takes some of the stretch off of the back. And you lay here till you feel a change. That may be belly sounds, that may be a change in your breathing, you may feel a softening in the muscles that you're loosening, you may feel a change in your thoughts or anything that feels different, because we're trying to change tissue memory, not just lengthen the muscle. So after you've done this stretch and you feel a change, slowly lift your legs straight up onto the bed. Avoid doing this, as that can sometimes irritate the psoas and make it recoil. And then what you're going to do is go into more of a straight position on your bed, and you'll grab two gym shoes. And this one, I already have a sock stuffed into it. And so I'm going to stuff a sock into this one to give it a little extra support. And we're going to use these as our wedges. Easy to travel with and inexpensive. If you don't want to use your everyday shoes, go to an inexpensive shoe store and buy the clearance item. I do recommend getting the same size as your feet, because that tends to match the size of your pelvis. So we're going to flip our gym shoes over so the soles of the shoes are facing up. Now, if you're able to, you would bridge up. You can place either one right in the middle, like this, and the goal is to rock your pelvis back so that your back is imprinting on the bed. Okay, now that was if you can't bridge up, you can roll to the side. If you can, you may want to try two shoes on either side of your glutes, like this. That's a little trickier to do rolling side to side, so that's why that one, it really is easier to bridge up. And once again, I want to feel that rolling back of my pelvis and the flattening of my tummy. That's how I know I did it right. Then this pillow I'm going to take out, and I like this little pillow to go under my head so that it's giving me a nice stretch from head all the way down. This is a wonderful position to stay in for a good 10 minutes and just focus on your diaphragmatic breathing. There's so many meditations on YouTube for diaphragmatic breathing, or anything that you're looking for releasing your stress, releasing anxiety, depression, preparing for a surgery or major life event. But lay in this position and just breathe in, feeling the belly rise and out, feeling the belly soften. And in this, you're opening up your lower back, you're lengthening your neck. Because of video purposes, I'm looking at you, but if I was doing this, I would have my head looking straight up. I may take the pillow and just do a little pull out, so I'm stretching my neck more. This is a great one to help shift and change your posture. If you're somebody who tends to stand with your back in this position where your belly sticks out a little bit, okay, especially somebody who's pregnant. I loved this one when I was pregnant because it just shifted everything back like this. All right, so those are your preparation stretches to do before the pelvic balancing class. So I look forward to seeing you. Bye.